Okay, thank you. Thank you for staying with us. We have come to the final part of my conversation with Dr. Amer on the mental health issues. And Doc, you said we have a good ecosystem, good doctors, psychiatrists, psychologists, counselors.
Right.
Okay, that's good. But my own experience, because I take a lot of ubat, high blood, this, that. I have about all sorts of problems. And that's not cheap.
Yep.
Okay? Now, if someone has mental health issues and they have to be prescribed over a long period, normally this sort of thing, it can be quite expensive, I guess.
Yep.
Now, can I take an insurance cover for that sort of ailment?
So I think there's 2 points here that you brought up, and I think they're both two valid points, and I think two interesting points. Number one is regards with the treatment and management that we give to our patients and whether it's an affordable issue. So we talked about just now mainly about accessibility.
Yeah.
We have a lot of accessible individuals that we can come into the service, but are these level of care affordable or not, right? So I think this is where, again, this is where I feel the beauty happens and the responsibility that we as Malaysians needs to make sure that this is protected. Whereby the public health, the public system that we have in the country subsidizes a large portion of these costs that you're mentioning just now. Yes, there might be some limitations. Some of our viewers might say but I can only pick medication A and B, right? Not C, D, E, F. But I think what's most important is that at least for the majority of people that might be struggling with financial issues, number one, you have accessible level of service. Number two, to a certain level, they're affordable. And the treatments that we provide for individuals are going to be evidence-based. Bukan cincai-cincai, cokai-cokai ni ubat actually. They're actually very good evidence-based medications. Cuma you might not have as much options as you have in private practice, for example. So when you go to private practice, just like in any part of health, it's a very expensive business, to be fair, to be sick. We can see that in America, it's probably the worst place to be sick. But it's not the same, it's not any different from our situation here, where definitely the cost would go up if we happen to access private health system. But for those who might consider cost and time, because the public health system, probably one of the limiting factors is going to be the time that you spend waiting to see somebody and getting all the treatment. So for those of us who can't wait, then we might access private health system knowing very well what kind of cost that we're dealing with. So I think that's where we have public and private health systems that are available. And you rightly mentioned, for those of us who, for whatever reason, maybe that particular care is not available in public. It's only available in private. Can we get it covered, right? So for those of us who are Muslims, definitely there's going to be some level of support from, say, zakats, various states. But the next one, of course, for some of us who might be a little bit more forward-thinking in terms of our health, we take insurance. But the question has been in the past and also in the present, does the insurance cover mental illnesses? In the past, no, sadly, right? In the present, I would say yes, but probably with a bit of a caveat there. Why do I say that? Because I've seen insurance companies, some of them having what they call runners, where it's not going to be the main bulk that you're paying your premiums for, but it's going to be this caveat whereby you can go for an assessment, which is covered, but when you get treatment, might not be covered. But there are new insurance policies that are available now, which you will cover at least the ones that we talked about: mood disorders, some psychotic disorders, obsessive-compulsive disorder, and some anxiety disorders.
Are you saying that most insurance companies will cover that?
Not most. There are some already available.
Why not? Why not we get them to cover?
I would love them to cover it. The thing that we want to make sure is that not only are they covering us before we get the illness, which is how it should be, but what about if we have some symptoms, but we have not been yet fully diagnosed with a mental illness? Can we get coverage for that? This is the kind of gray area that sometimes we hear a yes and sometimes a no. And I like the way you think that everybody should be able to get coverage. They might have to pay a bit extra because they're at higher risk, but they should be able to get that coverage. And I think this is where we are still working hard in trying to ensure these companies try to do some assistance for these people that we are dealing with.
Yes, I think because even when we had this COVID outbreak, remember the issues of insurance came out.
Yeah.
You know, like certain things you don't cover. You know, this and that. And I think the government should take a very proactive role.
I think we should get one of them on this show too.
Oh, they won't come. I don't know. I don't know, but I hope they can. Because, insurance business, as you know, is a very profitable business.
Yeah.
I don't know if any insurance company is not doing well. And I know that Bank Negara has got a lot of say in how they function. And Bank Negara is government.
Right.
So Bank Negara should listen to the people more than the big companies, you know. And I hope to see that all these ailments, as you said, it might not be apparent in the beginning of the diagnosis, but actually it's a serious matter that most people probably can't afford to go through the motion of finding out and finding the cure.
Yeah.
Because these are all long term, Doc. So I hope that our government will look into the issue of insurability of these ailments,
Definitely.
Okay, my final point today, Prof, is this. I read somewhere, I'm not really sure, about the Minister of Human Resources, I think Stephen Sim.
Right.
Now, he made some announcement about creating volunteers in the workplace to help understand these mental stress issues, mental illness issues, and how they can help their colleagues or they can go through the motion. So can you please explain a bit of whatever you know about this program?
So I think first of all, I have to admit, that I have not actually seen that particular write-up, but I'm aware of at least two kind of services that have been put in place. And it might be something that they were elucidating to. One is in government services. There's a team called ACRAPs, where where they would be among staff, and it would be more of a counselling sort of role where they're trying to identify individuals struggling, both at work due to performance and also possibly a mental health condition.
Yes.
And then provide some level of support. At the same time, during COVID, we've been introduced to this particular term, an acronym called MHPSS, Mental Health Psychosocial Support Services, particularly among the communities where it was pushed. But I've been informed, or at least I've seen, that there are groups that are trying to push it across into various industries. And it could be this is the one that you're eliciting to, where people in an organization are then introduced to very basic mental health information to identify how to talk to these people, and then to show them towards the services that might be available in that organization and also beyond. And this MHPSS is done among normal people, as in like the normal community public. It's almost like a community service, or another way to look at it, it's almost like a first aid service that we do for mental health. So you've got your CPR that you learn in school for those who might suddenly struggle with a chest condition, but MHPSS is probably the kind of that kind of service that they provide for lay people to then identify individuals around them that might be struggling, know how to talk to them so that we don't have that problem that we discussed just now in terms of stigma, and then hopefully at least have knowledge about what's available in their place and in their local community so that these individuals can find help. So in a way, if this is what is happening, then this is a positive move, I think, towards trying to, in a way, communitize mental health care and also knowledge to the people, particularly in these relevant industries.
Okay, now, I know I said the last question, but actually I have another one. I just crossed my mind.
No problem.
I should have raised it earlier, but I see correlation, and this is pure observation of a layman, no proper understanding of psychiatry or whatever. I see correlation between the drug addiction and racial composition.
Racial composition, okay.
Okay? It's been many years.
Yep.
It's been many years. This is like statistically speaking, that Malays suffer the most of this drug addiction, whether it is ganja, whether it is, compared to the non-Malays.
Yep.
Apparent. Now, I'm from Kelantan, a very poor state, and I think drug addiction there is also very high.
Yep.
Of course, some people say it's because we are close to the Thai border, so there was a lot of smuggling. But I think there is a social dimension to this. I think if you live in a poor state, we all know what's like, in a deprived situation. We tend to get quick fix, and drugs a quick fix. So my question to you is this: one, why is this disparity between Malays and the others for drug addiction generally? And second, whether, like I said, poverty or lack of other social stimulants, I would call it, whether lack of freedom, lack of social environment, whether that also helps to create this problem.
Well, I think it's a really good question, and I think there's two ways of looking at it. Definitely, I think going back to your second question, I think poverty definitely is a driver, and it's been seen, at least in research, to be one of the leading risk factors for developing issues of mental health, including drug addiction. So the poorer the state, the poorer the country, the more at risk these countries and states might be in terms of, we call it social ills in society, including drugs. In fact, often even look at like issues like smoking, for example, one would expect that because of the price of a cigarette that you'd have individuals at the higher echelons of society to be using more, but actually it's the opposite, right? We're often seeing individuals that are at the bottom of the bracket struggling with this, and of course other drug use as well. In terms of the numbers, it's a bit hard to say, to be fair, because when we look at the numbers and they're large, the population that, say, for example, the Malay population in our country is going to be large. So just statistically, by proportion, you're going to look like it's a huge number of individuals that are among one racial group more than the other. However, if you look into the data, for example, health issues like alcohol use, you'd get individuals that are considered to be Bumiputra to be the highest at-risk groups, not actually the Chinese or Indians, at least, within that group. With regards to cannabis, often we would see the Malay groups are going to be at risk, and similarly with the opiate epidemic. But again, it's not that other groups are not affected. There's often this statement whereby, for example, when meth first came out many years ago, it was seen in the Chinese population before it sort of evolved across. So I think the numbers that we see that might be high might just be by the proportion of these individuals. But going to your second question, I think definitely we can't refute the fact that poverty is a major risk factor that might contribute. And then in states that have, not only are they poorer, then they have a bigger group of a certain population, then it looks like the problem is even bigger than it really is, just by that proportion in that situation.
Okay, now, thank you. It has been an interesting 45 minutes talking to you. Thank you very much for coming here. I hope we can have another opportunity to talk about, probably not drugs, maybe we talk about something else. I don't know, depends on your interest. We could talk about whatever you want, because this podcast is, as long as it's educational, we think, so long as we think it can help some segment of the society, and then so we use this opportunity to expound our views, and hopefully it will help. Thank you very much.
Thank you very much for having me here.
Yeah, thank you. Yeah.